Today we have Kathy Fisher joining us from Home and Community Services. But now I'd like to introduce our first presenter for the day, Mary Wood.
Good afternoon, everybody, and thanks for joining us today. We're here today to give you an update regarding the application process for both Classic Medicaid and Modified Adjusted Gross Income Medicaid. We also want to talk to you about the new form that we've created for applying for Classic Medicaid. And I think one of the things that we really want to share with you is that we really did hear from folks that the process that we had kind of mapped out and designed way back last year and how we would have applications flow through Health Plan Finder really wasn't working all that well. And we heard back from you guys on some of the issues and problems that you were having. And because of that, we really have kind of made some changes in how we apply for Classic Medicaid in the hope of making it easier for families and for those assisting family members to do that. So first of all, I wanted to thank you guys for your suggestions and comments over the last couple of months, because it really is that kind of feedback that makes the process better. So today then, we're going to first start here with Classic Medicaid. And as a reminder to everybody, these are the programs that we consider and have named here in Washington Classic Medicaid. So when we talk about Classic Medicaid, we're talking about the Aged, Blind, and Disabled program. You may sometimes hear that referred to as SSI or SSI-related medical. We're talking about the long-term care and waiver service programs. We're talking about the Medicare Savings Program, health care for workers with disabilities, and also foster care for our children here in Washington. It's important to note that under Classic Medicaid, under the Affordable Care Act, there really were not a huge number of changes that impacted the program. And so basically how income is looked at and how resources are looked at and how income and resources are verified, all of those things really remain today as they did prior to passage of the ACA. Eligibility determinations for those programs that I mentioned, the Age, Blind, Disabled, HWD, long-term care, and Medicare Savings programs continue to be managed by DSHS, either at the Community Service Office or at one of the ALSA offices throughout the state. Eligibility determinations for these programs continue to be done in ACEs, and there is not what we have become accustomed to under the MAGI methodology, a real-time determination. The eligibility still has to be entered into ACEs by a worker and a response given back and a notification sent out to the families. Renewal process times for Classic Medicaid have also not changed. And the one thing, though, that has changed is how folks apply for coverage. And that's what we're here to talk about today, because we are going to put out a new form here in May for folks to use to apply for Classic Medicaid. So this is then, on the next couple of slides here, we'll give you just kind of a sneak preview of that new application. The form is going to be an 18005, and if you have been working with families applying for Classic Medicaid, you probably might have recognized this number as the supplemental application. And instead of continuing to have this supplemental application, what we've done is just created a full application, if you will, for our Classic Medicaid programs. So effective May 1st, the new version of the form will be used as a standalone application for those Classic Medicaid programs that we just talked about on the previous slides. On the next page here, Karen, is a copy of the new application, and I know it may be a little hard for you to see on your screens, but this is just kind of a sample of what that application will look like for all of you. And this is going to be the one, again, that folks are going to use to apply for Classic Medicaid for these programs. The new form enables, it has a couple of features, because if a family applies using this new form for Classic Medicaid, it's going to directly route the application that the family fills out to DSHS, either to Long-Term Care Services or to the Community Services Office. As you probably know, with the application for MAGI, which is the 18001, when you turn that application in, it kind of gets routed right over to Healthcare Authority and right to the Health Benefit Exchange to be entered through the Health Plan Finder. And quite honestly, that became a barrier for families. And so when you fill out for an individual who's wanting to apply for one of those Classic Medicaid programs, when you fill out an 18005, doesn't really matter where you drop it off on in that sense. It's going to be routed directly to DSHS through their systems, and it will just speed up the opportunities for a worker to get to that application and process it for you. As we kind of alluded to, if you have someone who's applying for one of our Classic Medicaid programs beginning May 1, they will no longer need to complete that 18001. That paper application will be used solely for those families who are wanting to apply or are eligible for a program under the Modified Adjusted Gross Income. And as a reminder, those under Modified Adjusted Gross Income are our family medical, our children's medical, our pregnancy medical, and our new expanded adult group. But if you're an individual and we're just looking at Classic Medicaid because you're a single individual, maybe age 70, then you would want to just go ahead and complete the 18005. Individuals will continue to have the option of either completing the paper 18005 or going online to washingtonconnections.org and completing an online application just like they've been able to do for years through that. So that online application function is still available to apply for Classic medical programs as well. So stakeholders, community partners, CSOs, and our healthcare home and community services offices, we are really asking everyone if they can take a look at the stock of applications that they have in their offices, and that if they can, if you are simply working with Classic Medicaid clients, if you can ensure that the old stock is thrown out and that you're using the new 18005. If you're checking on dates on that application, that old application would have a revision date of May 2013. And of course, the new one that you're going to receive will have a revision date of March 2014 on it. You can find this form online, and Karen has given you the address there where you can download that application in English. And the 8 supported languages will also be available for you beginning April 28th so that you can use it.
Yeah, and on the website, what will happen is the English version will be available and also available to download and also to order. But the 8 supported languages will be available on the website for printing locally, but they won't be available to order probably until about maybe the first week of, the end of the first week of May. And we'll get a notice out.
Great. Thanks, Karen. Just as a reminder as well, and I think I talked about it in the previous slide, is that if you're applying, one more, Karen. Oh no, go for it. I'm sorry, hon. And again for it. What? There we go. Thanks. Okay. I was just trying to throw Karen off the thing there. On the previous slide, that if you're applying, Karen, here we go. Stakeholders, individuals applying for Classic, if you can go forward, Karen. I'm about slide 18, huh? Let's go here. Sorry, guys. Yeah, right there. Thanks. If we're applying for MAGI, Medicaid, and I think we talked about it on your earlier slide, there is no change in how you do that. We encourage individuals to go online to Washington Health Plan Finder if they're comfortable in doing an online application, or if they're more comfortable in doing a paper application, they can certainly complete the 18001 and turn that in. That application, again, beginning May 1, will be for programs where individuals are applying for family, children, pregnancy, or the new adult group. Okay. And Karen, are we going to take questions, or are we going to wait until the end? We have a couple.
We have time for just a couple questions. The first one is the new 18005 application. Can it be used for someone applying for Alien Emergency Medical Apple Health through Healthcare Authority, or must we continue to use the 18001?
That's a really good question. We didn't have that on there. For our Alien Emergency Medical, remember to receive Alien Emergency Medical, you have to be related to a Medicaid program. So if you're working with someone who's related to a Medicaid program because they are parents with dependent children, pregnant woman, a new adult with, someone under 65 with income under 138, then you're going to want to use the 18001, or you're going to want to go online through Washington Health Plan Finder. If you're working with an individual who is over the age of 65 or who's on Medicare, or who we're going to be relating to our classic Medicaid programs, then you're going to want to complete the 18005, or you're going to want to go online through Washington Connection and apply for coverage there.
Okay. If a person goes through Health Plan Finder or the 18001 and is ineligible for MAGI Medicaid, what is the process for continuing an application for Classic Medicaid?
We still have in place, even though, and in both systems, in both online systems, be it Washington Connection or Health Plan Finder, there are prompts that help individuals along the way if by chance they've applied and they're not eligible for, in your example, for MAGI coverage. So if someone went through Washington Health Plan Finder or completed an 18001 and it was determined they were ineligible, say, for the new adult group, if they had marked that they were needing one of the long-term care services, or if they were over 65 or on Medicare, it's going to create a type of referral that will go over to our DSHS partners, and they will work off of that referral and follow up with the family to provide the additional information that they're going to need regarding resources and income, because income and resources, as you know, are treated differently under Classic. So they're going to send out probably that 18005.
So Kathy, this is Kathy Fisher with Home and Community Services, and thank you for letting me be part of this today. So really the way that the referral process works isn't changing until July. So this is kind of like step one in a two-part process to transition this change in how we process the Classic applications. We're waiting on ACES system changes, which will happen in July. And so until then, the current referral process that has been working since the Health Plan Finder went live will continue. It will, when we receive the referral, it's automatically going to generate that letter. It is going to mail out the old version of the 18005 until we can get that changed, and that will happen in July. So there's going to be that kind of 2-month transition period until we can get that changed. When the system changes, then what will happen, that letter will change. It will still generate every time we get a referral. And so it will send out the letter, it will send the application form and ask the clients to send that back to us. And then when we get that back, it will be routed back to our hubs rather than back to the Health Benefit Exchange so that we can work on it.
So hopefully that process has been working for families. We're seeing applications over there. Kathy's getting referrals now, so that referral process is working for families. But like with everything, we'd love to hear back from you if you're seeing issues or problems with that.
Okay, great.
So I think we're going to let Kathy take a few slides here and talk about how to apply for Classic Medicaid.
Great. So like with any change, it's always going to be very confusing to start with. And so what we've tried to do here over the next couple of slides is map it out for you based upon population. So if this, then follow this process. And I know we didn't capture everyone. The AEM question was a really great example of one we didn't capture. But obviously we can make updates to this as we go along. So the age-blind disabled populations, they're an interesting group because for some of them, they have the choice of whether they go through the MAGI door or whether they go through the classic door. However, those that are age 65 or older or who are entitled to Medicare really are, the best way for them to go is through the classic door. They really don't have eligibility through MAGI. So the programs that we can look at for them would be the spend down program, medically needy, either with or without a spend down, our SSI-related categorically needy coverage, and the Medicare savings programs. Those applications can continue to be submitted online through the Washington Connection site, and the information is up here on the slide. These particular ones, we would want you to mail them to the DSHS Community Services Division PO Box, which is listed here. You can fax it to the CSD fax line that's listed, or you can provide these applications in person at a local community services office. And so the community services side of the DSHS is going to remain the primary point of contact for these programs. The other group, those who are under 65, who are blind and disabled and don't have Medicare, this is where it starts to get a little bit more tricky because really we have to look at income there. So those who are under the 138% of the federal poverty level, even if they are receiving Social Security disability payments, but they're in their waiting period and Medicare hasn't started yet, then they're going to be eligible for that modified adjusted gross income, new adult coverage. And so we would still recommend that you direct folks that meet that criteria through the Health Plan Finder site. Those who have income over the 138%, well, again, they have that choice. They could look at perhaps qualifying for health insurance premium tax credit through the Health Plan Finder, and maybe they would like to go that route, sign up with a qualified health plan, or they still have the option to go through the medically needy spend down program. If they want to go through medically needy spend down, again, we would encourage them to apply through the processes that we talked about on the previous slide through the community services office. Now my favorite, long-term care programs. And so long-term care programs are really ones where we're looking at long-term custodial nursing home care. So we're not really talking about those folks that are just for a short-term rehab stay in a nursing home, but ones that, it's going to take them a little bit longer to transition out of that nursing home into the community. We also provide services for in-home personal care, either through our COPS waiver or associated DDA waivers, or perhaps we're looking at residential placement, so in an adult family home or an assisted living. If any of those types of situations apply to your client, then we recommend that you send those applications. If you're mailing in the 18005, you send it to the DSHS HCS, Common Community Services Hub, and then we can get those imaged directly to our HCS offices. And so there's different information up there. You would drop that off in person at an HCS office. You'd fax it to our HCS toll-free line. If you have questions, contact your HCS office, or again, you can still apply through Washington Connection. We'll accept applications that way as well. We also have a long-term care specialty unit, which I manage, and they process applications and changes of circumstance for the Developmental Disabilities Administration waivers. They also manage all of the hospice caseload statewide, the Healthcare for Workers with Disabilities program that Mary will talk a little bit about in a later slide. And then they also manage some mental health residential treatment programs. These would all be what we would consider classic Medicaid. They're all related to being aged, blind, or disabled. Now, the slight tricky piece in the specialty unit is that they also manage the KO1 program, which is long-term care, which is a MAGI-based program. So I want to talk to you a little bit in the next slides about the difference between those two and where to send those applications. Okay. So our specialty unit is a virtual statewide unit. It sits within various DDA offices, and I think in one region it actually sits in a DCS office, a child support office. But they don't have like a storefront, so they don't have a community services office that you can go in and drop applications off. So those applications, the best way to get them to that unit is to either mail the HCA 18005 form, the new one, to the HCS hub, or fax it to our HCS fax number, which is at the hub, and then that gets imaged directly into our records. Or they can submit them through the Washington Connection site, and we'll make sure that they get sent over to the specialty unit to work. The specialty unit also, like I said, handles the MAGI-based long-term care, or KO1, as many folks know. And again, we want you to send those to the HCS hub. Now, the difference with this group is this is MAGI-based, so if you're applying online, we encourage you to submit those applications through the Washington Health Plan Finder site. We need to wait for that site to make a modified adjusted gross income eligibility determination first before we can move on to the processing of the long-term care piece for these folks. And so I'm going to be talking a little bit further on in the presentation about our KO1 application process, just because we get lots of communications from hospitals and from community partners on how do we get these applications, what do we need to do. So we hope we're going to spend a little more time going into more detail on that process.
And do we have some questions for Catherine?
We do. Let's see. There's a lot, so just 1 second here.
Good.
Okay. Can someone with Medicare now qualify for Apple Health instead if they become income eligible?
Well, I think the term Apple Health is really a very broad term, and we are over time changing the word Medicaid here in Washington to Washington Apple Health. So even individuals who are receiving classic Medicaid or who are in long-term care services like Kathy was just talking about and getting Medicaid, that really is considered Apple Health. So Apple Health is just a brand name, if you will, for Medicaid in Washington.
Yeah, I think what I took from that question was, can people transition between the groups? So if there's income change, can they go from classic to MAGI? And I don't remember, I think there was a caveat in there around Medicare, and it's tricky with Medicare because folks with Medicare really aren't eligible in the new adult MAGI group. However, they might potentially be eligible as a parent of a dependent child or a caretaker relative of a dependent child. So, it's one of those things that's really tricky on where to tell you the best way to go. But yes, they can transition between groups. If you took Medicare out of the picture, then certainly they could transition back and forth between coverage groups.
And I think one of the things that, and we're working on this right now, is there are folks every day who are aging out right now of our new adult group because they're turning 65. And there are folks every day who become eligible for Medicare because they've served their 2-year wait period. So I think we'll see folks going more from MAGI, if you will, into classic Medicaid rather than the other way around, simply because there's just more opportunities for them when they lose their new adult coverage because they gain Medicare or they age out of the program. So, and we, as with Medicaid, as it's always been, we're required to redetermine eligibility, and we will be doing that for all of those individuals as they age out.
Yeah, and we do that also.
Right.
So we have a team of staff that have access to the Health Plan Finder and do those medical determinations. So if somebody was to lose their long-term care coverage and was potentially eligible in MAGI, we're running them through the Health Plan Finder.
Right.
Okay, it looks like we need a quick explanation of what is MAGI Medicaid.
Oh, I'm sorry. So MAGI Medicaid stands for Modified Adjusted Gross Income, and we kind of use the word MAGI or MAGI, depends our feeling of the day, but it means Modified Adjusted Gross Income. It's a new methodology that was given out under the rules under the Affordable Care Act, and those individuals who are on Medicaid and related to family, children, pregnancy medical, or the new expanded adult group have their eligibility determined under this methodology. And so we kind of just split, if you would, our Medicaid caseload into groups that have it done by MAGI and then our classic Medicaid.
Okay. All right, so let's go ahead and we'll save some of these questions for the end if we have extra time.
Great. So our next section then is going to be on the Medicare Savings Program, and this is kind of just a referral or a refresher maybe for some of you. But depending on income and resources, the Medicare Savings Program can help an individual pay for their Part B premium. And for some individuals, the Medicare Savings Program can pay not only for their Medicare premiums, but it can also pay for their Medicare costs, including their deductibles, their co-insurances, and their co-payments. So on the next slide, Karen, it shows the various Medicare savings programs that we have here in Washington, and there's really 4 programs, if you will. The first one is the QMB, or Qualified Medicare Beneficiary Program, and if an individual has income low enough, and that is under 100% of the federal poverty level, then we can not only pay their Part B premium, but we can also pick up the cost of their Part A if they don't have free Part A. We can pay their deductibles, we can pay their co-pays, all except for any co-pay they might have associated with a prescription drug cost. We have another group of, they're called SLMBs, or the Special Low-Income Medicare Beneficiaries, and for these individuals and for our qualified QI individuals, number 3, we pay their Part B premiums. And the difference between these 2 groups is simply the difference in the amount of their countable income. If someone's income is up to $135,000, they're a qualified individual, and they can only receive help with their Part B premium if they're not active on Medicaid. If their income is lower and they're a special low-income Medicare beneficiary, they can be both on Medicaid and also get help through this Medicare Savings Program. Our last group is really a small group of individuals. I'm looking at Kathy. At any given time, we just have 1 or 2 individuals across the state that are eligible. And this is for a qualified working disabled individual group, and it does pay individuals who are eligible for that. It does pay their Part A premium. The Medicare Savings Program is kind of unique in that you can apply for that program using the 18005 that we've been talking about today, that classic Medicaid application. But you can also apply for it using kind of a modified or reduced application, and it's called the Medicare Savings Program application. It's a little simpler, and so if an individual is just wanting to apply for the Medicare Savings Program, they're not wanting us to look at full either categorically needy or medically needy Medicaid, they can apply using the 13691, the application for Medicare Savings Program. It's important to note, if you're applying for someone and you want the either DSHS to look at their full benefit or scope of coverage for them, then I would really recommend that you complete the full application, the 18005, and they will look at both ongoing Medicaid, CN or MN coverage, and the Medicare Savings Program for them at the same time. So there's no need to fill out both, but some folks are only interested in the Medicare Savings Program, and if that's the case, you can use this more simplified application. On the next slide, Karen. So applications options then, as we just talked about, you can either use the full combined form, the 18005, or you can use the 13691, just the Medicare Savings Program application. If a client is eligible for any other classic Medicaid program, direct the MSP application to the CSO or to the CSO or Home and Community Services, depending on who's helping them. If you're just applying for someone just for Medicare Savings Program, then you'll want to direct that application to the community service office, and we'll use the same addresses and faxes that were given in the previous slides for talking to or for sending documents in.
Right, and Mary, I think just a caveat that any time we receive an application for classic Medicaid and they have Medicare, we're going to look at them for their eligibility. They don't have to apply separately for that. And especially for long-term care, we have different rules around how people qualify for QIMBY.
Yes.
And so we will always screen in a Medicare savings program when we receive an application.
Good. And Kathy, isn't it true, I think the system, is it now built that it almost automatically pulls that program up in ACEs, or is that still true for that?
Sounds like technical details.
No, sounds like technical. Okay, well, we'll talk about that later. So then the next slide then just kind of gives a resource. There is a publication that talks about the Medicare Savings Program. So if you're working with individuals who are eligible for Medicare, you can always order this publication. It kind of helps an individual ballpark, if you will, whether they might be eligible for the program. You can see on the bottom there, it gives in the bottom page there, it gives like a little calculation where someone can do a back of the envelope calculation to see if it'd be worth their effort to apply. This is available to order. And Karen has put the website up there where you can order that. The updated brochure is coming out very soon, so I would recommend if you don't have a stock of these yet that you wait until after that new updated version is out. And Karen, how will folks be, will there be a notification when the new version is out, or how will they know that?
For the 18005?
Or for this one? The 22?
Oh, it should be actually, I would say by the first week of May it'll be there.
Oh, it should be there.
It's the same link, and it'll just, so the 22-500 will just change over to the new version.
Okay.
Yeah.
Great. Thank you.
Really early May.
Really early May, I'd be looking at reordering those if you want. Our next program that we just want to give you a highlight about is the Healthcare for Workers with Disability program. And that program enables individuals with disabilities to work and to continue to keep their health care coverage. So enrollees are able to earn and save more money and to purchase health care coverage with monthly premiums. And those premiums are based on kind of a sliding income scale. The benefits, one of the benefits of the HWD program is it does provide that individuals can actually earn more than is what is considered substantial gainful activity under the Social Security Administration. They can actually earn more money than others and still retain their eligibility for this program. And so individuals who are eligible for HWD, they have no asset or resource test. And this is, I think, the only SSI-related or classic Medicaid program that we don't have to look at assets or resources. And once again, it's developed so individuals can earn some money and still be able to purchase and have health coverage. Since this is a categorically needy program, so they have full scope of care, if you will, and it also provides Medicaid personal care services. So if individuals especially might be needing some help at home to enable them to get to work and be with personal care services, they're able to receive that as well. Healthcare for Workers with Disabilities is also an additional eligibility group under our home and community-based waivered service programs that's administered by ALTA and Kathy's group, and also with the DD, Developmental Disabilities Administration. So individuals receiving services through those programs can also access this and do to get their personal care services. We use that.
A lot of folks that are on the Healthcare for Workers with Disabilities program.
Right. So it's really a great program. Applications for Healthcare for Workers with Disabilities can be submitted to Home and Community Services. And the address for that is given here. You can do it online. You can apply through Washington Connections through this program. You can also complete the 18005 and you can send it in and it gives the Home and Community Services P.O. box, or you can fax there to that. If you have questions, Kathy's put down there the toll-free number for that program as well.
And so this program is actually managed by our long-term care specialty unit, which is that virtual statewide unit. So, the toll-free number goes directly through to our worker there, and if they're not available, they will call you. They will call you right back with questions about HWD.
Really good. So, Karen, I don't know if anybody has any quick questions either about HWD or Medicare savings programs.
Okay, is the HWD program for undocumented individuals as well?
No, it is not. It is not for undocumented individuals. So you have to be eligible for, meet the citizenship and immigration requirements for Medicaid to get that program.
Okay, let's see.
And that would be true of the Medicare savings program as well. Just in case someone wondered, you have to meet the immigration rules for Medicaid to be eligible for the Medicare savings program as well.
If someone is on Medicare, can they apply for Washington Apple Health for secondary if they meet income criteria if they are under age 65?
Yes, yeah, they sure can. And so the issue would be is going forward, a lot of individuals are only going to be eligible or are eligible in the new adult group, and I think the two most important things to remember about the new adult group is that if you're over 65 or older or on Medicare, you simply can't receive coverage under that group. The only coverage for ongoing categorically needy or Medicaid needy coverage is really through our classic Medicaid program.
Okay.
Yeah, really the options they have is going to be spend down if their income's over,
right,
the SSI payment level, which is quite low.
Right. And Karen, can I add something here, because I think it would be just really, I think it's important to note, we've tried to keep as many individuals, and Kathy alluded to this 24-month waiting period that individuals have to wait to get Medicare. So if you're under 65 and you're disabled, but you're waiting your 24 months to get Medicare, you can be on the new adult group, which provides a really robust benefit package for you. It's great coverage without any out-of-pocket expense. Now, what's going to happen to individuals when they turn 65 or when their 2-year wait period is up and they become eligible for Medicare, we have to close them off of the new adult group and we need to move them over into classic Medicaid. The problem is if their income is over, what, Kathy, 791 or about 75% or so of the federal poverty level, they're going to be in spend down. So as soon as they get Medicare, they're going to lose their coverage for that full benefit package that's offered under the new adult group, and they're going to move into, in many cases, the medically needy spend down program for them, which is going to be, I think, a difficult transition for individuals who are facing that, and for you if you're helping families with that. I mean, they're going to have questions, and it's going to seem not very fair that I get Medicare and suddenly I'm going to have more out-of-pocket costs. But that is the reality of the programs that the feds have put out for us.
And I think that's where it's really critical for us to look at those Medicare savings programs,
yes,
because the folks that have income below 100% of the federal poverty level, if they're eligible for the qualified Medicare beneficiary program, it's going to wrap completely around that Medicare benefit that they receive and pay their premiums, their deductibles, their co-insurances, their Part B co-payments. There really should be very little left unless it's not covered by Medicare. So some I think mental health treatment programs are not. But generally the combination of Medicare and QMB is almost as good as your full
coverage.
is.
It really is. And as a reminder, those are folks, Kathy, help me get it, those with income under 100%, right? So if they happen to have income over 100%, those are ones that we'll probably be seeing a loss in their or an increase, if you will, in their out-of-pocket medical costs when we switch them over. So, thanks, Karen. That was a little digressed, but
okay.
The next program that we just want to talk briefly about, and it is considered as a classic Medicaid program, but it's very unique. It's our foster care medical program, and it really does not require an application in that we provide medical coverage to children up to the age of 21 who are in and out of home placement. And this includes children who are in our foster care placement through the Children's Administration. It includes children that are under our adoptive support placements, and once again, that's through Children's Administration. It includes our tribal foster care placements. It includes children under the voluntary placement through Division of Developmental Disabilities. We have children that are in group home placements under the Juvenile Rehab Administration. And we have children that are enrolled in what is called an unaccompanied minor refugee program. All of these children are served under our foster care program with the foster care team that sits here at the Healthcare Authority, and they continue to receive classic Medicaid. There is no application required for this program, and as I mentioned, staff here at the Healthcare Authority, in conjunction with the Children's Administration or with the tribes, receive notification that a child has gone into one of these placements, and they automatically open up Medicaid for that child while they're under that program. We also wanted to just talk briefly today, and just to make sure you were all aware of this, under the Affordable Care Act, a new program was created for children who have aged out of foster care. So beginning this January, just a few months ago, if you were a child who aged out of foster care here in Washington, and if you're between the ages of 18 and 26, you are really automatically eligible for continued foster care medical. And that is the full categorically needy scope of care coverage. It also is regardless of what your income is. You simply need to be a resident of Washington. There's no application necessary, and what the Healthcare Authority foster care team is doing is we kind of do continued, if you will, polls in our eligibility system to determine if anyone has come in to apply at any point who was formerly in foster care, and if so, then we contact them to look at moving them over into this program. So they would continue to get full scope CN coverage up to their 26th birthday in the month in which they turn 26. If you're at all interested in the foster care program, Healthcare Authority does have a publication about that, and we put the number up here for you. And like all of our forms, it's available for you to order. And this form was updated just recently in February, so this one's current and up to date if you want to order that. Okay. And I think, Karen, we're going to move right into the KO1 program so we make sure that Kathy has enough time to go over this. Okay.
So KO1, that's an interesting name, but of course we get the name from a lot of our ACES system codes. So it happens to be the medical coverage group used in our eligibility system. But KO1 is a MAGI-based long-term care program, so it uses that modified adjusted gross income methodology in terms of which income we count and whose income we count. It provides full scope coverage for clients who need nursing home care or long-term inpatient psychiatric care. We provide it for some children under the age of 21 in the state hospitals. And it's also used for any individual that meets that criteria below, the child under 21, a newborn, a parent under 65 years of age, or a pregnant woman who's hospitalized over 30 days, who perhaps is not eligible using the MAGI income when we look at the whole household income together. Once a client meets our institutional status, which means they've been in that institutional setting, so they've been in the hospital for 30 days or longer, we only have to look at the income of that individual and not their spouse or their children or anything else. And so sometimes that means that we can get people into coverage that wouldn't necessarily be covered using the household income. So I've got some tips coming up here on how to apply, but some things just to remember is you can't use the HCA 18005 form to apply for the KO1 program. Basically because it asks a lot of information about income and resources that we don't need for the MAGI-based populations, and we don't want people to have to fill out a lot of unnecessary information. We recommend you don't use the Washington Connection website, as applications are not automatically routed to our specialty unit to process, and it may result in delays in getting the applications processed. We do want you to fax or mail applications to the HCS fax number and mailing address that we gave earlier. But for these particular applications, since you'll be using the HCA 18001 form, there's a cover sheet that we would like you to use to attach to the application, so we know that this is specific for us to look at the K-track and not to send it on to the Health Benefit Exchange first. And then you can follow up with our specialty unit by phone or email if you need information on an application that you've submitted and you want to know what the status of that is. Next slide just gives you an idea of what that cover sheet is. It does not have to be our official cover sheet. If you want to create something that looks exactly like this and fax it to us, we'll accept that. The basic key to it is our hub just needs to recognize that this is a KO1 application. So there's several options about applying for KO1. So option one, like I said earlier, you can submit your online application through the Washington Health Plan Finder. And when you do that, you want to fill it out just as you would for a normal application. You want to include everybody in the household and their information and their income. But when you get to the additional screenings questions page, there's questions there that ask if anyone in the household needs long-term care or if they're living in a facility. And that's where you'd want to indicate that the child or the adult that's in the hospital needs to have long-term care coverage. And you'd say, yes, they're residing in a hospital setting. And then we would ask, if you're helping a client to apply through this program, if you send a follow-up email to this KO1 applications at dshs.wa.gov mailbox, and then provide us the following information. The name of the head of the household and the date of birth, the name and date of birth of the child or the adult that's applying, the date admitted to the hospital and the date expected to be discharged, if you know that, obviously your contact information, and if the client wants us to continue to be able to discuss your application, the application with you, we would need a signed client release or authorized representative form. But when you send that to us, that goes directly to our long-term care specialty team, and then we can flag that to follow up and look for that application coming through the Health Benefit Exchange. If a child or an individual is eligible for MAGI-based coverage, we just stop there because that pays for the services that it's full CN coverage, and it pays for the same scope of benefits that are available under KO1. And so we don't have to go that extra step and look at the KO1. If they're not approved when they go through the Health Plan Finder, that's when our team will go in and process the KO1 medical for the child or the adult if they're eligible.
So, Kat, can I ask if they go through and they do the application, and let's say that it was a child and the child was eligible for Apple Health for Kids, they would not need to send any kind of this notification to you at all?
No, they don't need to follow up with us if they're eligible. Usually what we see is, the type of applications we're seeing is when you look at the whole household income, it's way above the Medicaid eligibility level for children. And so it's putting the children into a spend down, or it's denying them, or telling them they have to go for tax credits. And we see it a lot for newborns, and we have a lot of hospitals contact us for help with newborns, that particularly the premature babies, but sometimes stay in a little bit longer. I think the other option that we have is that you can mail the completed 18001 form to our PO box. That's the ALTSA hub. And if you do that, that's when we would say, please attach that KO1 cover sheet, because we have a different process. Like Mary said earlier, anytime DSHS receives an 18001, we just go right off to the Health Benefit Exchange with it. And so these particular ones, we want to stop and make sure they get put into the DMS record for our staff to be able to work. Next slide. Please do not mail or fax KO1 applications to the Community Services Office Imaging Unit. They probably don't know what to do with them, and certainly don't follow this special process. So that covers on that one. And then the last option is probably the easiest option for a lot of folks, is you can just fax it to us directly at our hub. And again, if you're going to fax it to us, please use the KO1 Cover Sheet, and that way we know where to send it. And then if you don't hear back, or you haven't got a decision one way or another, either through the Health Benefit Exchange or from us, follow up with us through that email inbox, or give us a call on the Long-Term Care Specialty Unit phone number, and we'll have someone look into that case and see if we can process it. Same applies to retroactive coverage. So, if they need coverage for a retroactive month, you might want to put that in the email to us as well and say, hey, they came into the hospital, last month. Can you look at coverage for that month for us? Great.
And guys, I want to thank Home and Community Services, because they kind of took on making sure that they would do all of these applications in particular for the hospitals, because we often hear from folks when someone, as Kathy said, when they've been hospitalized, and it's over an extended period of time. So I think this is going to really help streamline those. But Kathy and I would both appreciate, if not today, as we move forward, if you see issues with the problem that or the process that we've put together. We've tried to do it in a way that would make it easier for hospitals and families who are kind of going through a difficult time anyway. Yeah. If you've got an institutionalized child, so it's a difficult time. So if you are finding glitches along that way in processing these, please let us know, and we'll do the very best we can to continue to try to improve this process. So great.
I think our team is very responsive to those phone calls and emails. So.
Yeah, so I think it's a great resource. And I would say if you got stuck along the way, that's where I would be calling, because they can certainly guide you through the process. So
how about let's continue, and we'll save a couple minutes at the end for questions.
Sounds good. So you guys, I just wanted to, again, I know some of this resource and contact information, if you've been meeting with us over the last 2 to 3 months, you've seen this information. But for some of you, if this is the first time on, this is new for you. So this slide here just gives you an idea of the various and different kind of call centers that you can refer individuals to, and it gives you a very high level of what that call center handles, so it'll help you kind of direct families to the right spot. The next 2 slides is a reminder of your HCA Area Representative and who is out there to help you in your particular county, and these are still valid. So if you have questions or follow-up on anything, you can give your rep an email or a call.
And just a reminder as well that you probably have all heard about that we've placed a healthcare authority community specialist who is an actual med financial worker in each county in the state. And so we are currently transitioning over for basic like health plan finder application issues, basic eligibility questions, and so forth. Those will now be transferring over to your local HCA community specialist. We'll get some information regarding that onto the training and education webpage, which we'll share that in just a moment, so that you all will have be able to reference that list. We've sent it out quite a few different times. It also, the reminder went out this week through the WACOMO listserv as well. So you're going to want to be transitioning your questions over to your HCA community specialist in your county.
And things like, things that would be really appropriate for your community worker would be, if you get an error, a pop-up error, and you can't get through it, they're there to kind of help you do that. If you get stuck with cases and they're really an eligibility question, or you've received a denial that you don't think is correct, or you're having trouble getting the case processed, those are the kinds of things you would want to continue to direct to your regional rep. But we're hoping that with our community-based meds workers, that they'll be able to help people with many of the issues that we were dealing with over the first few months of implementation, and be able to get that process quicker for you, so that hopefully you'll get a same-day result if they can get in there and get that taken care of. The next slide, you guys, just gives the websites again for our training and education page for the reps if you want to download that information, and for the referral list that we just went over. It also gives us the box for the Medicaid expansion contact us. So if you have things that you want to email us, you can use that box, and Karen monitors that for us.
If they have questions from today, could they send some questions to that box if we don't get to them?
Yeah, they sure can.
It seems like there's a lot that we might not get to.
Yeah, there is. So you do, Kathy's right. If you have questions from the day, if you send them there, and we'll work with Kathy to get those answers out so that anything we don't get to, you can have answered on that. And then finally, for future webinars, we talked about this the last time. We do have a tentative webinar for May 8th, but we are kind of waiting to see if there are any specific topics that people have that they want to go over. And if you do, you can email us in these last few minutes onto the webinar, or you can let us know, and you can send those suggestions to the Medicaid expansion box listed here, and we'll try to put those together for the May 8th webinar.
And most likely the announcement, if we do decide to host a webinar in 2 weeks, then we'll send it out before close of business tomorrow through our regular email distribution list.
And if not, guys, if there's nothing really pressing that folks are wanting to hear about, which is good news, means things are starting to settle down, that's fine too. But we'll continue to have the option to have this forum. And so maybe if we choose not to meet for a month, and then maybe if something comes up that we want to sit down and share, we'll send out another announcement, and so it's not like we have to do them every 2 weeks. If it ends up that we do them once a quarter or once a month, that works fine for us as well.
Right. So. And for any HCS or DDA staff that are on, Karen's going to send me the PowerPoint, and we're going to have it loaded to the ULSA website.
Great.
So it'll be available there, and we will also be sending out a management bulletin with this information to our social service, AAA staff, DD case managers. So there's probably a lot of questions around when are they going to get the information. So we're working on that, and I know there's a joint memo going out. Yep. I know Manning's already signed it, and B's signed it, so CSD should be sending that out shortly.
Yep.
Right. And so today's presentation was also recorded, and we will send that as well as a copy of the slides through the regular email distribution list. We'll send that out probably sometime late next week, like we typically do. And then I also want to just remind those that are on the phone today from DSHS that work in a local community services office or home and community services office, just letting you know that we are sending a small supply of the English 18005. We're sending those to each office, and they should be arriving April 30th or on May 1st. So each office will get a very small supply.
Yep.
Yeah. And I think probably just, we only have time for maybe one question, and I think the most prominent one right now is, as a in-person assister navigator, what is their role? So there's a lot of confusion around this where, so like what's in place for an applicant who maybe can't fill out the application or doesn't have computer access, where do they go? And what's the role of a navigator? So oftentimes there's a little bit of confusion, and I do know that we're working with Community Services Division right now on this, and the local community services offices when someone does go in and they try to apply and they get referred from the office to a navigator in error, and so there's a lot of confusion going on. So,
well, it's kind of a tough one to answer just in a short time, because I think the broader question that I think we're all asking about is what is the role of the navigators as we move forward into 2014 and then into 2015, and especially in light of will there be additional funding, and if so, and what amounts, and all of that. Unfortunately, you guys, I wish we had all the answers to that. All of that is still up in the air. Families can contact anyone within the community to help them. They can, for health benefit exchange, anything that's MAGI, they can continue to call the health benefit exchange, and if they wanted to apply over the phone, they certainly could do that. Or they can complete an application and turn it in, so they're not required to go online themselves and to fill that out. Now, for many people, the online option is they're very comfortable with online, and they can certainly do that, and of course, we strongly encourage that. But for individuals or families who are not comfortable with applying online, they can apply by completing either the 18001 if they're a MAGI household, or the 18005 if they're classic, and they can send that in just like we've always done for Medicaid. So, I mean, people have always been able to apply by paper, and they can continue to do that. I think what I would say is one of the things that's always amazing to me is that Medicaid is so huge, and even me sitting here listening to Kathy, I learned something a little bit new every single time, even though I've worked with Medicaid for years. And so I'm sure for some of you, maybe this is the first time you've heard that there was such a thing as KO1, and that if a child was in a hospital for 30 days or 45 days or 3 months, a newborn in there for 3 months, that we might be able to look at medical and not even have to consider parental income. And so even if you take that away as a nugget and you're working with a family, if you just remember, hey, when people are institutionalized, even in a hospital setting, and the parents may not have insurance, maybe they didn't get signed up during open enrollment, and they have a child that's really ill, or they're ill, and they have to be in the hospital for a long period of time. Gosh, I remember there was something about KO1. So I would think, what would we like to see as navigators or community partners? Just that they take that little bit of knowledge away and know that, hey, I remembered something about a program that might be able to help a family.
And I think I would just finish up as a final takeaway that this is a lot of new information. It's confusing, and these are not hard and fast rules.
Right.
These are meant to be guides to help you, no matter where you send the application, right, whether it goes to the health plan finder or to Washington Connection or to a CSO or to an HCS office. We will ensure it gets to the right place, right, and it will be worked for the right programs. So don't feel like you have to know it all, right, as of day one.
Right, and all this does by giving you these things, it just speeds the app along. Do you know what I mean? It'll get it to the worker quicker. So